So let me hop to Sita's question about setting rates. So let me show you in the dashboard too. I'll talk a little bit about it now. And I also made a video on this in the dashboard. Let me direct it to you. So, and I just uploaded this recently. So money mindset and strategies for setting your initial fees. So that goes over some of the info too. Really, for setting your initial fees, there's like only 3 options. There's one, setting like moderate fees, and then the second the patient questions it, you're like, no, just kidding, they're a third of that, and you slide. That's like the not recommended version. 2 is setting moderate, reasonable fees, and then knowing that like you're going to increase them, so not like crazy high fees, but as you gain confidence in your ability to kind of get in patients, provide value for those patients, you increase them over time. And that's what I did. And it's good. Like the idea is you set fees just higher than you feel comfortable with. Like it should sting a little bit when you're saying them on the phone, or else you're not doing it right. It's like you just have to get over that fear. It's exposure. So, but then option 3, which I didn't do, but is probably the best option, is to just start out of the gate with high fees. Because like the only downside is that you have to have like an iron will. Like your brain is going to be like telling you like, no, you're not going to succeed, this isn't going to work, who do you think you are? You have to just not listen to any of that. So like to have that approach to doing it. But the benefit is that you will eventually be charging those fees. It's just a mindset block. And it ends up being more complicated to have 100 different patients at 100 different fee rates. I'm kind of in the situation where I have a bunch of patients at different fee rates, and it involves some tracking. Like I have to keep track of it. I keep it, I use QuickBooks, and I have notes in each patient, like account what their fees are. And then at the end of the year, have to do a spreadsheet so I know what to raise the fees, and I'm doing that now. So it's like doable, and that's what I'm doing, but it's easier. It's like less complicated if you just start off super high. But for all like full disclosure, I didn't do that, and I'm pretty like strong-willed, so it's okay if you don't do it that way, because it's like mentally hard. I mean, you can see in the group the fees that we're all charging, and we're all having practices. So I would just encourage you to push yourself on like on what's possible. Let me ask, I didn't say like a specific number there. Are you kind of, what range are you considering for your
So that's part of my issue. I'm trying to do maybe Utah and California, and in Utah, like initial intake fees seem to be varying widely. So there's someone who went to my residency who's charging, and trying to take a holistic approach, but charging $300 for an intake. And then there's someone else who I think just moved to Utah from New Jersey, and she's charging $500 an hour. So it's like 300 versus 750. Where do I fit? And of course, I'm feeling more like I'm just out of residency. Who am I to charge more than this guy was my chief resident, right? So I know part of that is like, yeah, I have to get beyond that, but I also am just kind of baffled about where to start.
Yeah, I remember having that where I was right out of residency, sharing office space with 2 former attendings, and I was charging more than them. And it's weird. They were undercharging was the issue. You know what I mean? And I can't stop them from undercharging. So like this, let me just put this as the framework, is it's all arbitrary. It doesn't matter. Just like pick a number. It's all about the patient's perception of your value. And people think about price in not a logical way. It's not a logical decision. It's like, will this person help me? And then what is my ability to pay? that's really limiting factor. People who can pay are willing to pay for value, and they're not like if I were seeing a service provider, I probably wouldn't even notice the difference between 600 and 300. It'd be like, okay, yeah, I'm going to pay that. There was a TMJ specialist I was referred to, and it was like $600 for just to see like a dentist essentially. And I was like, okay, well, I got to see this guy. Like, it just, I don't have the time to not see someone who can't help me. It's much more important than the price that you are providing a good experience from the patients. Obviously good clinical care, but like you're shepherding them into a whole experience from the from your website to your first contact to the clinical care to the follow-up to everything. So don't get caught up too much in the money, because you're going to change it in a couple, there's no way around it. You're going to change it. You just have to start and have the number end in like a 5, have it be in a high, because just that's like the basic psychology of pricing. But I mean, I would aim, if someone else is charging $500 an hour, like that means people are paying it. And this is the other thing too, is that people who can afford to pay that amount for services are kind of turned off if something's too inexpensive. It's like, it must not be good. And they've done all these studies on like people typically choose like there's some people that choose the mid price point on whatever. And there's some people that always choose the highest price point, no matter what the price is, no matter what they're getting. It's just a psychological thing of like, well, I want the best quality. So I want to pay I don't want to pay too little like that. How could it be high quality if it's too little? And also this may sound self-serving, but it's sincerely true in terms of the way the psychology works. People will take it more seriously if they're paying more, and then they'll get better. The clinical outcomes are better if people are more engaged in the process. Like I remember in residency, like you see therapy patients and the program charges them like $25 an hour, and people are like missing a point. It's like 25. There's then like even me straight out of residency, I was charging like 300 an hour, and I wasn't any better 3 months later, but like patients, they took it more seriously. So like, don't obsess over the specific numbers, and it's all just like a illusion anyway. Just charge something and then grow into it.
That's super helpful. Thank you.
Okay.
I have a question. How do you know when it's time to raise rates again?
When you feel like you can. Like when you're like feeling a little comfortable. When it feels like, oh, my day's a little too easy. Is when I do it. I mean, it depends. It's like if you're making enough money and you're happy, and that's your goal, then we're not trying to gouge people. I personally like raising rates because it challenges me to be a better clinician. Because I'm like, all right, I'm going to raise my rates, and then I'm going to figure out how to deliver at this level. So I would say that's kind of like the way to think about it. I personally like to challenge myself by doing it pretty frequently. So Lisa, when she told me that I was charging like $12.50 for an intake, she's like, oh yeah, I know, like the intro thing, in New York is $1,500. I'm like, yeah, I'm going to charge $1,500 then. And I didn't feel comfortable with it, but I was like, but how do I deliver the $1,500 level for the intake? And I study, I like read books, and I figure out how to improve my offer. And so for me, it's kind of like a fun game, but not everyone has to do it that way. But that's kind of how I would think about it, is you could anytime, whenever you want to increase your rates, is a way to challenge yourself to get better.